Hyponatremia. Hypo, low level, nat means sodium, emia, blood. So decreased level of sodium concentration below 135 milliequivalent per liter is hyponatremia. Assessment findings: neurological, generalized skeletal muscle weakness, headache, and personality changes. Respiratory, shallow respiration. Cardiovascular, cardiac changes depend on fluid volume. Nausea, diarrhea, explosive, and increased GI motility, increased urine output. Treatment: restore sodium levels to normal and prevent decrease in sodium. Drug therapy: intravenous therapy to restore both fluid and sodium. If severe, we may use 2 to 3% saline. Administration of osmotic diuresis, mannitol, to excrete the water rather than sodium. This mannitol play important role for diuresis, I mean loss of water, and increase the concentration of sodium without addition of sodium. So it play a role in internal sodium balance, I mean distribution of sodium between the intra and extracellular spaces. Increase oral sodium intake and restrict oral fluid intake. Also to increase the concentration of sodium. Hypernatremia, when the serum sodium level is more than 145 milliequivalent per liter. The contributing factors: hyperaldosteronism. Aldosterone or renin angiotensin aldosterone system is very important factor in controlling and organization of the sodium level. So hyperaldosteronism, aldosterone will increase the absorption of the sodium and water in lieu of Hilli. The second, renal failure, inability to excrete sodium will lead to the hypernatremia. Corticosteroid also preserve sodium and water. Increase in oral sodium intake. Sodium containing fluid, IV fluid. Decrease urine output with increased urine concentration. Loss of fluid in case of diarrhea, dehydration, fever, hyperventilation, lead to the increase the concentration of sodium in the blood. Manifestation of the patient: neurologically spontaneous muscle twitches, irregular contractions, skeletal muscle weakness, diminished deep tendon reflexes, respiratory pulmonary edema, diminished cardiac output and heart rate and blood pressure depend on vascular volume. Heart rate and blood pressure depend on vascular volume. Genitourinary system: decreased urine output, increased specific gravity. Due to concentration of urine. Skin: dry skin, edema related to fluid changes. Treatment of hypernatremia: drug, half concentration normal saline, 45%, if caused by both sodium and fluid loss. Will administer sodium chloride. If inadequate renal excretion of sodium, will administer diuretics. Diet therapy: in case of mild hypernatremia, ensure water intake.